Governor Korane, Mzee Haji, Senator wa Garissa, Members of Parliament, Honorable Aire and Honorable Duale, my sister, Member of Parliament, the County Women Rep, Honorable Anap, the rest of the county leadership, my own team from the Ministry of Health at the national level, led by Dr. Rashid, our guests from the Igad states, and my sister, led by my sister, Dr. Vazuia, the Minister of Health from Somali, the representative from the government of Ethiopia, the representative from the government of South Sudan, the Igad team, led here by Engineer Malim, the son of Garissa, our partners, led here by WHO, Dr. Rudy, and UNICEF, Dr. Wana, all the other leaders and participants who have gone to make this day as memorable as it is. Na wakaaji wote wa Garissa, salamu alaikum. Salamu alaikum. On behalf of the government of Kenya and the Ministry of Health in particular, I wish to take this opportunity to welcome you all to this joint vaccination campaign launch here in Garissa. I would like to sincerely thank all of you for creating time to join us today and to participate in this very important event. I wish to commend Igad for coordinating the 8 member states and making this event a reality. This noble idea to work together as a region for a common cause is our endeavor to eradicate, polio, will go a long way towards further strengthening our collaboration in the health sector in this region. Great achievements in the health of populations globally, communicable diseases still remain a big burden despite of what has been recorded as having been achieved. Children who are less than 5 years are particularly vulnerable to diseases because their immunity is not fully developed to fight diseases. Polio is one such disease affecting this population. It does not cause paralysis and disability alone, but also results in mortalities. This has been well articulated by our ambassador, Senator Kichumba, who has shared his own experience. Immunization through safe and effective vaccines offers children full protection against polio. It is because of this that the national and county governments in Kenya continue to invest heavily on immunization programs to ensure availability of vaccines for our populations at no cost. Ladies and gentlemen, as has been articulated, the WHO in 1988 agreed on the goal to eradicate polio. It is the second disease targeted by the international community for total eradication after the successful eradication of smallpox in the year 1977. Kenya, being a member state, adopted this eradication goal and the recommended strategies for the same. Due to the concerted global efforts to eradicate polio, the cases have decreased, and we have only 1% to go, having achieved 99% since the year 1988. Today, we have only 3 countries, that is Afghanistan, Pakistan, and Nigeria, which remain polio endemic down from 125 countries in the year 1988. More than 10 million possible cases of polio-induced paralysis have been averted as a result of these global goals, which signals great hope that polio eradication will be achieved by the end of this year. Ladies and gentlemen, despite of the gains that have been made across the globe, the Horn of Africa has experienced repeat polio outbreaks, mainly due to importation fueled by undernutrition, low population immunity, and displacement. Massive movement across porous borders in this region present one of the most significant challenges to stopping poliovirus's transmission. As you know, insecurity and constant conflict in our region, which has resulted in displacement of large population, also continue to be a major contribution factor to the spread of the virus. During the year 2013, the polio outbreak, which was reported in this county, 14 people were paralyzed by polio, and we also recorded 2 deaths. At the same time, a similar polio outbreak was occurring in Somalia with 105 confirmed deaths at that point. And this is why, ladies and gentlemen, we must tackle polio through a synchronized way. This year, Igad region has recorded 6 circulating vaccine-derived polio viruses cases. 5 were in Somalia and 1 was in Kenya. This clearly confirms that all countries within the region are closely intertwined and face similar polio threats. In working together, it is Kenya's belief that we have a better chance of winning the fight ahead of us. My ministry, working with counties and our partners, plans to reach over 2.8 children in 12 high-risk counties, including Garissa, with the life-saving vaccine in the coming 5 days. This will complement national vaccines and immunization program, which is currently running under the Rapid Results Initiative managed by the Ministry of Health, and where we have set our targets of reducing the numbers of unvaccinated children aged below 1 year from 500,000 to less than 100,000 in a period of 100 days. I am glad to note that in 40 days of this initiative, we have seen a reduction from 56% of children who have been vaccinated up to 66% coverage of the country. This means we are well on course to achieving our targets under this initiative, which will come to an end at the end of the month of October. I wish, ladies and gentlemen, to speak to the safety of the vaccines that we are using for these 2 initiatives, the polio initiative and the RRI vaccination initiative, and to confirm that these vaccines are safe. They have undergone rigorous safety procedures during manufacturing and are indeed very safe. This has been confirmed by our national laboratories. I wish, therefore, to request you, the parents, the guardians, and the communities in the 12 affected counties to take your children who are aged less than 5 years to receive the polio vaccine during the next 5 days starting tomorrow. Wamama, niruhusu niwazungumzie kwa kichache ndio tusikizane hapa. Wakubwa wenyu wa kisiasa wamesema ya kwamba tumehofia, wengine wanaandika ya kwamba hii campaign na vaccine ambayo tunatumia, mambo ya kupigana na polio uwezekana ikawa si sawa, na wengine pia wameweka propaganda ya kusema ya kwamba hii vaccine ama hii dawa ambayo inatumika huenda ikawa ni ya mambo ya family planning. Nataka niwahakikishie ya kwamba hiyo ni propaganda. Tumefanya analysis na niko hapa kuambia ya kwamba hiyo propaganda sio ukweli hata kidogo, na kwa hivyo kina mama na ambao sisi tumeachiwa kuchunga watoto kama guardians, ningependa niwaulize tutoke na tupeleke watoto wetu wapate chanjo ndio tuweze kupigana na ugonjwa wa polio. Niseme ya kwamba pia sisi kama serikali hatuwezi kuwa ni sisi tunalazimisha watu mambo ya family planning. Hiyo ni chaguo, na kwa hivyo vile Senator Ambassador wa polio Honorable Kipchumba ameongea nasi akiwa mmoja wao alikuwa ni victim, tupeleke watoto wetu kwa chanjo, tusiwafunge na tusiwapatie watoto wetu maisha ambayo tungeweza kuepuka nayo ya kuwa vilema, kwa kuwa sisi hatufanyi yale Mungu ametuita tufanye ya kuchunga watoto vilivyo. Nikizungumzia kwa vile pia mambo ya kupanga jamii na family planning, hiyo ni program kando, na mwenye anataka kwenda hiyo ni maneno ingine. Nije kumalizia nikisema ya kwamba nitoe shukran za dhati kwa washikadau wote ambao tumeshikana nao na ambao wamefanya sherehe ya leo kufana kabisa, ikiwapo ni partners, development partners wetu, World Health Organization, UNICEF, CDC, USAID, Red Cross, the core group, LDS Charities, Igad, ikiwapo ndugu yetu Maalim na timu yake yote, na pia shukrani zangu kwa government of Garissa ikiongozwa hapa na gavana wetu, Gavana Ali Korane, na wakubwa wengine wa